As kids prepare to return to school in the next few weeks, we here at Matthewsville Medical Group wanted to take a few minutes to answer some questions and concerns that we've been hearing in the office from parents in regard to kids going back to school and COVID-19. I'm Dr. Alicia Apple. I'm a pediatrician at our Rockrimmon office. I'm also a mom to a toddler, and I have several friends and family members who are immunocompromised.
And my name is Dr. Nguyen. I too am a pediatrician, and I work at the Matthewsville Southeast office. I am a mom to 2 school-age children who will be returning to school in person next week. One of the common topics that's brought up by parents is the issue of wearing masks at school. And parents tell me, my school is recommending that my child wear a mask in the classroom and in common places. How can I make it so that my child is successful in doing this? Please know that masks are safe for your children. They don't impede oxygen flow, and they are safe to use during the school day. Masks come in very different types. If you happen to have a mask that allows for a filter, you can purchase a coffee filter for this purpose. One way to start having your child get accustomed to wearing a mask at home is to have them wear it during screen time. And for some of your younger children, have them practice putting a mask on their favorite stuffed animal. Really, if you as parents practice wearing masks, your children will also do the same. A recent study is recommending against using neck gaiters as masks, and bandanas are also a popular option, but not recommended for use at school since they don't stay in place.
In continuing on the subject of masks, I was asked, is it important for children to wear masks while they're doing outdoor play at school? Some schools are not going to be doing outdoor activities or PE, but some will. And it's important to understand that if your child is doing these activities outdoors, the likelihood of transmission of COVID-19 is very low versus an indoor activity. Also, if your child is wearing an N95 mask to school, it is not recommended that they wear that while they are doing any kind of physical activity, as that can impede their ability to get enough oxygen in while they're doing high intensity activity. If they are wearing an N95, please send them to school with an alternative mask to wear during outdoor activities. Wearing a mask outdoors is safe and fine for your child, but it is not vital to protect them from COVID-19.
So another concern that has been brought up by parents is, now that my child is returning to school, are they going to transmit the virus to me? And yes, there is a possibility of kids transmitting infection to grown-ups. And the risk of this is much higher in kids 11 or older. Just like adults, kids can be asymptomatic carriers, and they can be sick and not know it. So it's important just to continue with good hand washing, social distancing, and really think about the necessity of traveling outside of your home for non-essential business.
That being said, let's talk about some symptoms that you might see if your child does have COVID-19. Symptoms in children are different than adults. It is important to understand that these are a little bit different than for an adult than for a child. Symptoms we'll see in kids are fever of 100.4 or higher, cough, shortness of breath, fatigue, muscle and body aches, headache, loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, and diarrhea. Keep in mind that these symptoms are common symptoms for a lot of viral illnesses, not just COVID-19. So it's important to talk to your child's medical provider about their symptoms in order to know if it's important for your child to be tested or not. Finally, there is what is called multisystem inflammatory syndrome in children. This is very rare, but it is a very serious complication of COVID-19. If you are concerned that your child may have this, please contact your medical provider for further recommendations. Symptoms of multisystem inflammatory syndrome in children can be found at healthychildren.org.
So far we've been talking about some of the physical symptoms of COVID-19 and how they can impact your children. Unfortunately, COVID-19 is also impacting their mental health, with a lot of children becoming very anxious about returning to school. So what are some strategies you can use to decrease the anxiety of returning to school with this pandemic? One is, it's very important to model calm in yourself. It is important to reassure your children. You don't need to over reassure, but do give them the confidence that the school is doing their best to keep everybody safe. The second thing is create some structure within your child's day so that there's structure, predictability, you can alternate chores with schoolwork. And finally, exercise is wonderful for a child's mental well-being. So schedule and try to find safe, socially distant outdoor activities for the entire family.
Finally, what do I do if my child does get sick? First off, stay home. Don't let your child go to school, and notify the school that your child is sick so that they can take proper precautions for the other children and the teachers there. Also, you need to contact your child's medical provider. You need to let them know what your child's symptoms are so they can give you best recommendations whether your child needs to be tested or not. They can also give you recommendations and treatment options. You should further review current quarantine recommendations. At this time, the CDC is recommending that any child who is sick with COVID-19 needs to stay home and isolate for at least 10 days after symptoms start. Anyone caring for the child also needs to isolate for 2 weeks after the symptoms resolve to make sure that they also are not coming down with the infection. Current recommendations can be found at cdc.gov. In conclusion, Matthews Zoo Medical Group wishes that your family is healthy and safe during this crazy time. We don't want anyone to have any issues, and we are here to answer any questions. Schools are doing their best to provide a safe learning environment for everyone.
And please reach out to your child's medical provider if you have any questions or concerns, because we are here for you. And while we do not currently have a COVID-19 vaccine, the flu vaccine will be available soon and is safe for children 6 months and up.